It's getting scarier and scarier to be hospitalized. So when you need a hospital procedure or surgery and they want to get you in and out quickly, it might not be such a bad idea. For more reasons than the money that the health insurance companies are saving by discharging you quickly. Well, Harvard School of Public Health just released the results of a new study showing that 43 million people per year are harmed by unsafe medical care. That's big.
Yeah, and it's a global number. It's not just the number of people in this country, although that number is probably vastly underestimated. We look at this country alone, there are about 1 million deaths that are caused by the medical industry as a whole. Take
Per
a look
year?
per year in this country alone. Gary Null did that in his great expose, both in a book and a film called Death by Medicine. So we're looking at something that's a huge problem, and it makes you wonder if we're saving more lives than we're actually causing. And that may sound like a silly thing to say, but you have to really be objective about that, or you really just don't know the answer.
Well, it's really amazing that so many people are hurt and disabled and also die from these millions of medical errors.
Right.
And we talk about medical errors, we don't mean just medicine. So let's talk about what some of the other causes are.
Well, they did this study, at Harvard, and they published in the British Medical Journal of Quality and Safety in September of 2013. And what they did is they reviewed 4,000 articles, and they looked at 7 outcomes that they felt were really important. First and foremost were adverse drug reactions. And then they looked at catheter urinary tract infections, and they looked at catheters that are in veins that cause systemic infections that sometimes are life-threatening, at hospital-acquired pneumonias, at different kinds of blood clots, falls, and bedsores. So those are the kinds of things I looked at. And there may be many other, or there are many other things that could be looked at in addition that would make that number bigger.
And this can affect quality of life for forever, like for the rest of your life.
Yeah, well, it's not a small issue. And they looked at, for every 100 hospitalizations, there were about 14 adverse effects amongst people who were in the upper middle class group. And for those that were in the lower group, it was a little bit smaller. It was more like 12.
So why do you think that there's a difference in your income as to what your medical errors
Well,
would
the
be?
question is more better? And it may not be. I mean, you look at people who are in the hospital, a lot of them are on 15 or 20 or even 30 medications. And I hate to tell you this, but there's no way that we have scientific basis for saying that those medicines will interact in a safe way and not cause a problem that we can't anticipate.
Well, healthcare isn't enough because we need safe healthcare.
Well, safe healthcare and real healthcare. We shouldn't be getting sick in the first place. If we shifted our model from a disease care model where we expect to get sick, and then we depend on our doctors and the medical system to bail us out, we're making a huge mistake, because an ounce of prevention is worth a pound of cure. That's just simple common sense. So here we are in a situation where we need to take a little bit more responsibility for our health care, because the system we have is dangerous. And until we do that, we're going to see numbers that are just like this. And if we change our system and focus more on lifestyle medicine, it would be different.
It's really something that we don't hear more about this. It's almost like it's kept undercover, because if there's wars or if there's a disaster, or even like with 9/11, I mean, there were, 3,000 people?
4,000 deaths, yeah.
4,000 deaths, which is terrible.
Well, we're seeing 2,000 or 3,000 deaths a day, from the effects of medications and from the medical system itself.
So something really needs to be done about this.
Well, we all know about it. The shift that needs to be done is one that involves a lot of money exchanging hands. And it's going to go from the status quo, which is the pharmaceutical industry, into wellness and prevention. And that's what we, the people, should want. Again, an ounce of prevention is worth a pound of cure. If we take care of ourselves through lifestyle medicine, we're going to feel better, we're not going to get sick as often, and we're going to have lives that are full of more vitality. That's for me.